Hi, I'm Eric, and today I'm going to be doing my physical assessment. Before proceeding, I would comply with all general principles and safety practices.
Come in.
Hi there, I'm Eric. I'm going to be your student nurse today. Could you tell me your name and date of birth, please?
Yeah, it's James Lively, 8/28/81.
Hi, James. Nice to meet you.
Nice to meet you.
Can you tell me where you are today?
Yeah, ACTs.
Okay. And are you married or single?
Married.
Married. Okay. Could you tell me your education level, please?
Yeah, some college.
College. All right. And your occupation?
Student.
Student. Me too. You have any hobbies or activities you enjoy doing?
Hunt and fish.
Hunting and fishing. Okay. Could you tell me your religious preference?
Christian.
Christian. Okay. If you needed a chaplain or somebody, I could call in for you. All right. I want to go over a little bit of your health history. First of all, have you had any surgeries?
Yeah, I had an appendectomy in 2013 and umbilical hernia repair in 2016.
2016. Okay. Any complications with either of those?
No, sir.
Did you have any childhood diseases?
Chickenpox.
Chickenpox and just the regular.
Yeah, regular old chickenpox.
Okay. Are your immunizations up to date?
Yes, sir.
Okay. Let's see. Do you have any mental or emotional problems that you're aware of?
No, don't want to hurt my body or anything like that.
Okay. Have you had any blood transfusions?
No, sir.
No. Okay. Anything about your lifestyle you just that might be put you at risk for injury or disease?
No, sir.
Okay. Let's see. That would pretty much put you on intimacy versus isolation for Eric's in the stage of development. Okay. Let's see. I'm going to go over some of your family health history, if we could. Is there any history of a heart disease?
Papa had a heart attack in 2001, quadruple bypass. Other than that, that was on my father's side.
Okay.
Nothing else.
Nothing else? Okay. Any history of substance abuse?
No, sir.
Diabetes?
No, sir.
Any cancer or arthritis?
No, sir.
Any emotional problems?
No, sir.
Okay. And why are you here today?
I got sore throat.
Sore throat? How long has it been?
A couple of days.
A couple of days? Okay. Are you taking any prescription medication right now?
Yes. I take Cozar for 25 milligrams for blood pressure.
Blood pressure? All right. Any over-the-counter medication?
No, sir.
All right. Taking any herbal or homeopathic medicines for your sore throat or anything
No,
like
sir.
that? Okay. If you could tell me your height and weight, please.
Yeah, it's 6'3" and 400 pounds.
Okay, you appear to be clean and well groomed. Don't have any real difficulty communicating. And let's see, I'm gonna first take over and take a look at your skin. First, I'm gonna wash my hands, put on some gloves. Alrighty, if you can hold your arms out, please. Okay, your temperature feels good. If you can lean back a little bit, I'm gonna check you for turgor. Okay, your response is fine. Okay, I'm gonna check your hair here. Scalp looks clean. I don't see any infestations, any lesions or sores. Your scalp does not appear to be overly dry or oily. Your hair full, evenly distributed. You haven't had any recent hair loss?
No, sir.
Okay. If you could open your mouth for me, please. Okay. Lift up your tongue. Okay. Put your tongue back down. Say ah. Okay. Your soft palate moves. Swallow reflex looks good. I'm going to check your nose out. No lesions or sores, no obstructions or material. If you could, place your finger over one nostril, breathe in and out. Okay, do it with the other nostril. Looking good. Okay, I'm going to check out your eyes. Let's see here. Just look straight ahead, please. First, I want you to follow back with just your eyes. Okay, your pupil response is good. Okay, then again, just follow my pen with your eyes if you could. I'll stand behind you. I'll bring my pen around, and when it comes into your field of view, let me know.
Good.
And this side.
Good.
Alrighty, let's see. If you can hold your hands out, please, I'm going to check your nails. Let's see. Nails are clear, no sign of clubbing. I'm going to check your capillary response. That looks good. Okay, now if you don't mind, I'm going to take your vitals. First, I'm going to check your BP. Now, if your arm was a little bit bigger, we might have to go with a larger cuff. Using a standard cuff on a large arm could result in an abnormally high BP. If I was using a big cuff on a small arm, I could have an abnormally low BP. Okay. Hey, you were at about 117/75, which is right there where you're supposed to be. If you were above 120/80, you'd be at risk for prehypertension. Okay, now I'm going to do pulse ox here on your finger. Okay, your blood ox is right at 97, about 95 to 100 is where you want to be, so you're very good there. I'm going to do your pulse and respiration. Right at 66, which again is right where you want to be. Let me take a respiration. And your respiration is about 16. Again, that's right where you want to be. If you are feeling any pain, could you rate it on a level between 0 and 10, 0 being the lowest and 10 being the highest?
0.
0, so nothing bothering. Okay, I'm going to take your temperature now. I'm going to do your tympanic, which is right here in your ear. Beep. Oh, you're at 98.5, which again is right where you want to be. Let's see, I'm going to listen to your heart. Your temperature, like I said, 98.5, that's good. If you were below, say, 97 or above 100, then we'd be out of the normal range. Okay, I'm going to check your heart rate now. And just breathe normally. Okay, everything sounds good there. Okay, I'm going to listen to your lungs. Each time I put it down, I just take you one normal breath in and one breath out.
Okay.
Very good. Okay, if you could just lean forward and cross your arms like this. I'm going to listen to you at the back. In Okay, sounds good. Lungs sound clear. All right, now I'm going to put my hands here, in and out, in and out. Okay. Could you say 99, please?
99.
99?
99.
99.
99.
All right. Looks good there. All right. I'm going to check your pulses. First, I'm going to do both your carotids one at a time. Okay. Hold your arm out, please. I'm going to check your brachial. Your radial. Over. Okay. Your arm. Brachial. Your radial. Over. Okay. If you extend your legs, please. Okay, I'm going to check your popliteal. Good. Okay, dorsalis pedis. Go through your shoe. Strong. And your anterior tibial. Leg. Dorsalis pedis. Anterior tibial. Okay. While I'm down here, back down here, I'm going to check you for edema. If you could just pull this up here. Oh, no signs of pitting on your leg. Okay, stand up for me, please, sir. Okay, I'm going to hand you stand here with your arms down at your sides. Close your eyes for me, please. Okay, your Romberg is negative. You have good balance. Okay, and then if you could, just walk this way for me, normal gait, or normal pace. Okay. Gait appears even. Now if you could, go heel-toe for me. Okay, and then walk back this way on your tiptoes. Okay, now if you could, I'm just going to do, just do as I show you here, kind of like Simon says. I want to take your right arm, reach back here behind your head, put it on your shoulder, and bring it around underneath to your shoulder in the front. Okay, now do it with your left, back, around the front, your shoulder. Okay, if you could, let's see, stand on one foot, put your foot out, wiggle it. Shake it all about, do the hokey pokey.
Hokey pokey.
Bend it at the knee. Bend your up and down. Okay. And then with your other foot out. Make it a little bit. Bend it at the knee. Okay, range of motion looks good. If you could sit back down, I'm going to take a look at your abdomen. First, I'm going to visually inspect it. I don't see any asymmetry. Don't see any bulges. Movements. Okay. Acetate. Okay, I have active bowel sounds in all 4 quadrants, which is good. I'm going to palpate here, and if you feel any pain or tenderness, please let me know. Okay, sir. Have you had any ostomy bags or
No, sir.
that? Okay, I'm going to ask you a few questions about going to the bathroom, avoiding habits. How's your urination? You urinate frequently or?
5 to 8 times a day, depending on how much
Okay.
coffee or water I drink.
Okay, and any unusual color or odor?
Anywhere from clear to yellow.
Okay,
No,
no
no
difficulty.
funny smells, no, just regular urine
No
smell.
difficulty going. You don't have spurts or stops or
No,
anything
sir.
like that. Okay, as you get older, you could. One sign of prostate trouble would be if you had difficulty urinating. As far as your bowel movements, how often do you?
Once a day.
Once a day. And the consistency?
They're formed,
Okay.
anywhere from a light brown to a medium brown.
Any tarry black stools or anything like that we'd have to talk about?
No, sir.
All right, looks good. Okay, the CNA will be in later to check on you. Here's your call light. And I'll be back to check in with you later. Gonna wash my hands up here before we leave. And you're all set. Thank you.